Acute cholangitis. Acute cholangitis is an infection of the bile ducts that typically arises from an obstruction, such as gallstones, strictures, or malignancies. The obstruction leads to bile stasis, promoting bacterial growth. Common pathogens include Escherichia coli and Klebsiella pneumoniae. Clinical presentation. Patients with acute cholangitis often present with a classic triad of symptoms: fever, jaundice, and right upper quadrant pain, known as Charcot's triad. In severe cases, patients may exhibit confusion or hypotension, indicating possible septic shock. Diagnostic imaging. Ultrasound is typically the first imaging modality used to assess suspected acute cholangitis, as it can visualize bile duct dilation and gallstones. Computed tomography scans and magnetic resonance cholangiopancreatography are also valuable for further evaluation and identifying the cause of obstruction. Laboratory findings. Laboratory tests in acute cholangitis often reveal elevated liver enzymes, particularly alkaline phosphatase and bilirubin levels. Leukocytosis may also be present, indicating an infectious process. Blood cultures are crucial for identifying the causative organism. Management principles. Immediate management of acute cholangitis includes antibiotic therapy and addressing the biliary obstruction. Broad-spectrum intravenous antibiotics should be initiated promptly to cover typical organisms associated with the condition. Endoscopic intervention. Endoscopic retrograde cholangiopancreatography, also known as ERCP, is the preferred method for relieving biliary obstruction and obtaining cultures. Endoscopic retrograde cholangiopancreatography can facilitate stone extraction, stent placement, or balloon dilation, significantly reducing morbidity and mortality. Surgical considerations. In cases where endoscopic management is unsuccessful or the patient presents with severe complications, surgical intervention may be necessary. This may involve cholecystectomy or biliary drainage procedures. Complications. Complications of acute cholangitis can include sepsis, liver abscess, pancreatitis, and renal failure. Early recognition and management are essential to prevent these serious outcomes. Prognosis. The prognosis for acute cholangitis largely depends on the timeliness of diagnosis and treatment. With early intervention, most patients recover well. However, delays can lead to increased mortality rates. Preventative measures. Preventative strategies include addressing risk factors such as gallstones and monitoring patients with known biliary disease. Educating patients about the signs and symptoms of cholangitis can facilitate early recognition and treatment.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.